How do you answer the telephone in your office? We all have telephones in our office, right? And they're there for a reason. They're there to communicate, or more importantly, to connect. Connectivity is the most important thing that human beings want when they're talking to another human being. Before a patient comes to your office, there are many different touch points. It might be the referral, it might be the neighborhood, it might be your website. It might be another patient that had a good experience that they met in a barbershop or the butcher's or at a restaurant. It could be anything. A lot of my patients come in because they were in a furniture store and they were, picking out furniture and they saw someone that had a good experience. Most of the good experiences that my patients have with my practice is not with me, it's with my team. And part of connecting with other human beings is the telephone. I think that telephone training should be part and parcel of everybody's practice. It's not. Most people don't have a telephone training team to come in. Matter of fact, the training teams that come in are almost like an anti-sales team. What do I mean that? It's almost like you have a team of people at the front desk, at the administrative area of your office that says, please, no business. We don't want any business. We want to keep you away. How are we going to do that? We're not going to answer our phone. And when we're going to do, we're going to say, please hold. And then make it even worse, put me on hold and give me an infomercial. Here are some suggestions that I have. Answer the phone pleasantly. Train your team how to answer the phone. Answer it within 30 seconds. And don't put anybody on hold. Now, occasionally you're going to have to do that. But if you have to, say, I apologize. We're extremely busy today. Should I call you back? Or would you mind if I put you on hold for 30 or 40 seconds? Give the patient the option to either wait 30 or 40 seconds if it's going to be 30 or 40 seconds, or to call them back. That way they don't have to waste their time. The most precious commodity we have is our time. No matter who you are, you can't create more time. So when someone's time is being wasted by being put on hold, they're going to get frustrated. So then give them an option, and then give them the service that they need. What a lot of practices do is they have a phone tree. Now, there's this one practice that I work with all the time. I know the front desk. There's 3 people there, but they give me 4 different options. If this is insurance, click on number 1. If you need a refill prescription, click on number 2. If you're an existing patient, click on number 3. If you want to leave a message for the doctor, click on number 4. It goes on and on. I know how many people in this office. Why am I getting so many choices? And by the time I get to make a choice, it's like 35 seconds. And then I click. And then sometimes the phone tree will do the whole thing over and over again. It's extremely frustrating, and it wastes my time. So I very rarely will make a phone call to a doctor's or a dentist's office or anywhere else if I don't have to, unless it's to someone's cell phone after hours. Because the phone could be a source of misery, could be a source of pain, or it could be a source of joy. I have a friend, he's a contractor, his name is Dan White. He says that he's very successful because when someone calls him, he actually picks up the telephone. He's in the roofing business, the siding business. I have another friend, Pete Doyle. You call him, he calls you back immediately. And he sells products. He sells insurance in New York City. And he's very successful doing that because he gets back to people. He makes a human connection. Oftentimes, us in dentistry and medicine, we don't make that human connection. We put people where we think they should be put for our convenience. To make matters worse, as we're inconveniencing them, we're letting them listen to an infomercial about the great service that we provide. I don't want to know that you're a great dentist. I don't want to know that you also do Invisalign, place dental implants, do beautiful cosmetic dentistry, and if I call now, I can use my insurance before the end of the year. It's almost insulting that you're giving me the kind of a sales pitch, because if you're really going to serve me, you'd be talking to me right now. To make matters even worse, this is my biggest pet peeve, is, sorry, we're having lunch right now. Our office is closed between 12 and 1. We'll get back to you during business hours. Isn't that when most patients call you during their lunch break? Or here's another one. Sorry, we're busy helping other patients right now. We'll get back to you as soon as we can. Well, aren't I a patient making a phone call? That's why I called your office. There's so many lost opportunities because we're not taking care of the patients that are calling us to serve. A phone call to our office doesn't require a marketing campaign. The marketing's already been done. They're calling your office. Be there for them. Be there to serve them. My patients, we spend so much time and money marketing. And then when the patients call, we're not there for them. Don't miss that opportunity. The phone call is one of the greatest ways to give your patients great service. And if you give them great service on the phone, they're going to want to send their family and their friends to you. and they'll be happier and their stress will be lower.